anxious patients, I love them. Yes, they're difficult to deal with, and yes, they need a lot of extra attention, but I like them because if you can make an anxious patient feel comfortable, they are so loyal to your practice. They are not price sensitive, and they will stay with you for years. And more importantly, anxious patients often haven't been to a dentist for 10 or 20 years. So on a scale of needing work or not needing work, these patients actually need help, as compared to the patients who are not anxious and go all the time and actually don't need any help at all. So I first of all decide if you want to have a practice with anxious patients, but if you want to do complex work, you should. The key with the anxious patient is not to think that the anxious patient is unusual and that the non-anxious patient is normal. That is actually the reverse. It's completely normal to be anxious about getting dental work done. Our mouth is the most sensitive, intimate part of the body. It's our airway, and most of the procedures we do, if they were anywhere else on the body, you would have a general anesthetic. How do I deal with them? This starts with setting expectations. So if you want to increase someone's stress, surprise them. So we don't want any surprises in our practice. That means from the first phone call, they are told exactly what's going to happen in that first visit, and what it's going to cost, and how long it will be. So that's to avoid surprises. So you want to continue this all through all of the appointments, that they know exactly what is going to happen, what's involved, and how much it will cost. When the patient walks in the door, we want them to feel calm, or as calm as possible. The sense of smell is deeply tied to emotion, and it's deeply tied to our limbic system. When we smell things, it gives us strong feelings, it takes us back to a place. And when you walk into a clinic, if it smells like a dental surgery and it looks really clinical, but particularly the smell, it will immediately bring out the anxiety that we've got from previous visits, if we have them. So one of the things that can help is remove dental smells from your office. There are a couple of ways to do that. We do it by having a fresh air conditioner, so our air conditioning system takes fresh air in, and there are a couple of dental materials like oil of clothes that I don't keep in the practice, and if I do ever use something that smells a lot, we immediately run coffee through a coffee filter or through the espresso machine to get rid of that smell. The second thing is, when dealing with the anxious patient, is you want to reduce kinetics. Kinetics is how fast people are moving. So if you get a patient and you move them quickly, their anxiety goes up. If you slow things down, their anxiety goes down. So if you take a patient and you sit them in the chair and you lean them back and you immediately got instruments in their mouth and you start talking about all the treatment and here's how much it will cost and okay, let's book you in, it's too fast, and as you speed them up like this, their anxiety goes up. So you want to slow kinetics. So one way to deal with them is sit them in a dental chair or in a non-clinical environment and just talk with the patient. You want to know what they want. They want to be listened to, and by listening to them and showing that you're listening, people start to feel cared for. So if you slow your consultations down, sit there and ask the patient a lot of questions, listen to them, find out exactly what they want, and then start looking in their mouth, you've slowed the kinetics down and they feel listened and cared to before you get to doing anything that's in their mouth. I don't do any treatment on most of my new patients. So I sit them there, I talk, we examine. I don't poke all their teeth because there is no need to. And most of the time that I'm in their mouth is only 2 or 3 minutes, and the rest is outside doing consultation. Now, after all of that, you still have to do treatment on the anxious patient. And so when you do the treatment on the anxious patient, don't let them get anxious. Now, it's normal to be anxious about surgical procedures, and most surgical procedures you have a general anaesthetic or you have sedation. So if you have a patient who's anxious, do a general anaesthetic or organise sedation. Even if it's not intravenous, you can still organise diazepam or lorazepam or some other benzodiazepine just to chill them down a bit. And when you chill them down, also their pain threshold drops, and so everything feels more comfortable. Life's too short to have patients sitting in the chair going through treatment massively anxious. It's too uncomfortable for them and it's too uncomfortable for you. So don't do it. whatever it is that's available to you, do something to reduce the anxiety, because the anxiety is often more uncomfortable for the patient than the procedure. So reduce that for their sake, but also for yours. You shouldn't be doing... An anxious patient is so generous. They want everyone in the room to be anxious as well, and you will be. So just chill everyone down. So in summary, with your anxious patient, make your clinic smell nice so you don't stir up their limbic system. Slow everything down and use something to control anxiety, some type of drug. Okay, you can't just tell people to get over it and it'll be fine, because that just makes them not listen to. But the good part is that when you sedate someone, or you do anxiolysis, or you put them under general anesthetic, you can do huge long appointments that are intensely productive, and the patient doesn't mind. It's good for them and it's good for you. And then of course, call your patients back, because then they can tell you how wonderful their experience was, and if they do have any problems, they feel cared for. Now, these type of patients, not all of them will get over, a lot of them will get over their anxiety, and in the future, they become a non-anxiety patient who is intensely loyal. But some of them won't, and they will need pharmacology every single time you treatment, and that's okay. It's not that expensive. It's not expensive to have a couple of Valium or something before your appointment. So anxiety patients, make the anxiety go away somehow, and mostly it's going to be pharmacology.